Hello, I'm Barnett-Itzhaki, and I would like to introduce you my recent research, the dynamic optotype, a novel visual acuity test for using children. The research was done together with my colleagues, Dr. Zohar Barnett-Itzhaki and Dr. Noah Elad Dalman. I have no financial interests or relationship to disclose. The way we test visual acuity didn't change much during the last century since it was introduced by the Dutch ophthalmologist Herman Snellen. Unlike static vision tests such as the logMAR or Snellen chart, a DYOP or dynamic optotype is a segmented circular figure composed of equally spaced gaps or segments which spin at a constant velocity. A patient is presented with two diops side by side, one spinning and one static, and is asked to determine the direction and/or the location of the spinning diop. What is detected is not so much the motion of the gaps and segments, but the strobic stimulus of the photoreceptors in the eye. Unlike static images, which get increasingly blurry as they get smaller, the spinning of a diop seems to disappear when the acuity threshold is reached. As the angular width of a diop diameter and the gap or segments get sufficiently smaller, the strobic stimulus is no longer sufficiently large enough for the spinning of the gap or segments to be detected. To your right, you can see a representative anatomical representation of the structure of the diop. Our research was a prospective study. Consecutive patients aged 4 to 17 years presenting for eye examination at the Paediatric Ophthalmology section of Meir Medical Center. Visual acuity enlists at least one eye in the range of 6 on 4.8 to 6 on 60 as determined previously with Lia numbers ETDRS chart. Distance visual acuity was determined monocularly using both the NMS Lia numbers ETDRS chart and the DYOP test, alternating the order of administration between patients. The worst-seeing eye of each patient was tested to obtain a sample across a wide range of visual acuities without fatiguing the children. The number of patients was 157, of them 76 males and 81 females. The mean patient age was 8.4 years and the range was 4 till 17 years. As we can see at the left diagram, there was a representation of different types of patients which we can see at the pediatric ophthalmology, and it was quite a representative population of pediatric ophthalmology clinic patients. To our right, we can see the raw acuity data of the Lia ETDRS numbers versus the DYOP. As we can see, the best corrected logMAR visual acuity range from minus 0.04 to 0.60 for the Lia numbers chart and from minus 0.038 to 0.65 for the DYOP. The logMAR visual acuity obtained with the DYOP test was 0.16 and 0.15 for the Lia numbers ETDRS. The left figure represents a blunt Altman plot of the differences between the acuities obtained using both tests plotted as a function of the mean of the two approaches. The plot demonstrates the limits of agreement of the tests, which were minus 0.13 to 0.11 logMAR. Defining one line as equivalent to 0.1 logMAR, the width of the interval defined by the limits of agreement was 0.24 logMAR, equivalent to 1.2 lines. To our right, we can see the regression analysis of the acuities of a DYOP as compared to the Lia numbers tests. The 0.88 correlation coefficient indicates that the acuities measured with the two charts have a strong linear association. The result of this first prospective study in pediatric populations supports the validity of the new DYOP test as a measure of visual acuity in pediatric patients aged 4 to 17 years over a wide range of visual acuities. There was a strong linear correlation of 0.88 and mean differences between the test of 0.01 logmar equivalent to less than 1 letter acuity differences. There was a good agreement, limits of agreement, as can we see at the Blunt-Altman analysis. In the context of individual assessments, the 95% limits of agreement were 0.2 lines, suggesting that in 25% of cases, the difference between the two measured acuities would be within 1.2 lines. The results of this study can alter and improve how visual acuity is measured in children. Thank you for listening.